Hello, I'm Dr. Martin Bales, and welcome to another video here at Cancer Center for Healing and Center for New Medicine. This is my esteemed colleague,
Fini.
And today we are going to talk a little bit about some of the other testing that Molly and I do. And I'll have Molly start off. Why don't you tell me a little bit about the heart rate variability?
Yes, it's called the Heart Quest, and it's testing your heart rate variability, and that's you want a high heart rate variability. It's the beats in between each heartbeat. So it's important that it's not like a metronome, just like a metronome that, you play with music that's just duh, duh, you don't want that. You want a high rate variability. And what's a really good way to describe it is, once I was reading an article about a doctor that says that, like, somebody that just runs all the time does not have a high heart rate variability because it's just that you're just running. But if you look at a dog, especially a dog, how they jump and they stop and they'll dig holes and they try to climb trees or they chase whatever, they have high heart rate variabilities because it's that motion and stop, and it's that kind of like shocking your body into something new all the time. And that's what we want, because if you have a high heart rate variability, you have a better chance of your heart responding and your body responding to stress. Whether it's physical stress, emotional stress, or whatever kind of stress, mental stress, your body can respond to that better, and you're healthier. You're actually healthier.
It makes sense because, as you described it, more heart rate variability is more activity.
Yes,
and so someone that sits on the
absolutely.
couch is probably not going to have high. So that completely
Yeah.
makes sense. And understand, this technology came out of Russia.
Yes.
I think about 40 years ago.
Yeah,
or something.
yeah. It's been quite a few years.
Quite a few years. Okay,
Yeah.
Okay. So they've had a lot of time to refine it.
Yeah,
of course. And how long does it take to run the test?
So it takes, like, when the patient comes in, it's not invasive. I just put some clamps on your wrists, and you just sit there and basically meditate, or just sit in the darkness and the silence and meditate for about 5 minutes, 5 to 7 minutes. It depends on each person, because some people's heart they're faster, beat faster, and so we just wait till it's finished, and then afterwards we go through. There's about 10 screens now. I think when you were doing it there were like 8 or something.
I think so, something like that, yeah.
But they've added the teeth, so the relationship between the teeth, the meridians, and the whole body. But we go through each screen and seeing how your hormone levels are related to stress. Like, I had a surgery about a year ago, and 2 weeks later I did the Heart Quest, and it showed just that surgery, how traumatic it was to my body, and my stress levels were off the roof. My cortisol, my DHEA was very low. I mean, it was surprising how much just a surgery, how much it affected your body. So it's really like, I call it the truth teller, because it really tells me whether it's a physical stress, whether it's an emotional stress, a mental stress, all of those stresses really affect your body, and how well prepared your body is to respond to those.
Wow. Well, it sounds very comprehensive.
It is.
I remember when I was doing just at the very start a little bit, there's a Chinese medicine screen, there's an Ayurvedic screen. I think, like you said, it's up to 10. So it really looks at the whole body through the heart rate, which is incredible.
Yeah, it does. It like your cortisol, your progesterone, all your hormones, like you're saying, like your chakras. Yeah. And then it will give you also an opportunity to look at different, like, whether you're, pitta or kapha or whatever, what food you should eat, or what essential oils would be good for you, or also what colors are good for you. So, and that's a little bit more in depth, but yeah, it's very, very comprehensive.
Wow. Okay. Well, thank you.
You're welcome.
I'd like to talk a little bit about another device I have called Brain Gage. Okay, and it doesn't say you're smart or you're dumb, something like that. This was technology developed for years out of University of North Carolina. And what they've done was actually originally to tell when a football player post-concussion was able to return to the field.
Oh, wow.
So a lot of coaches and the players themselves wanted to rush back on the field, and they found that after having one concussion, if that concussion had not fully healed, and they went back on and got another concussion, it was like really, really bad. Okay, it went from bad to worse really fast.
Right.
So they were able to tell if the player was able, or when the player was able to get back to the field. So that's what was developed. But then they realized, we could brain gauge anybody and see what their mental abilities are in different areas. So just like you have screens for your Heart Quest, there's 7 different metrics that are used that show what my brain gauge is doing: plasticity, accuracy, speed, judgment, and then there's a composite score. And yeah, the patient's birth year is put in as part of input at the start, and then it compares to a national database. So you're not compared to some punk millennial. That is compared to actually your age, and it shows what percentile you land with that, and it's captured in mine takes about 25 minutes.
Oh, okay.
It's a little mouse type device that has 2 buttons, and there's different games that it plays with the.
So the patient actually has to. They don't just sit there; they have to participate.
That is correct. Yeah, it's more of an active as opposed to our other equipment is more passive. So it does require some activity, which requires focus. I actually tell the patients to close their eyes because they're really interacting with how these buttons are vibrating and the speed of which, and then it requires a response on the behalf of the patient.
So they're not looking at a screen; they're
doing things. The screen tells, but I'm with the patient as you are the whole time. I don't just put them in the room and have them do it. Yeah. And I'm able to explain before each test what they need to do. Oh, okay. Because if somebody doesn't understand and they don't get a good score, it may not be because they have poor brain function. It's just they didn't understand what to do.
Right.
So Molly and I are with the patients during these tests all the time. We don't just put someone in a closet
and forget about them.
Yeah. So it sounds like yours is a really comprehensive test, for the whole body.
Yes.
That's done, and then if the patient has symptoms of mental inacuity, or you pick it up on yours, then we can kind of zoom in and see on mine what in more detail. Maybe their speed is good, but they don't have really good accuracy. And we can kind of see what we need to do about it.
Exactly. One of the things I wanted to mention on the HeartQuest, there's actually a screen that gives you breathing exercises, and it's not just for everybody, it's for you might test different than I do, and so your breathing exercises, it will tell you it's this really beautiful, nice, relaxing, calming music, and it's this bubble that goes out, and it's it goes out, exhale, inhale, exhale, inhale, but yours might, if somebody's heart beats really fast, and they might be more, a slower inhale, exhale exercise, but the patient can actually sit there for 5 minutes, and they can actually video it and go home and practice morning and night, and it really makes a difference.
Wow. So that would probably, it's one of the questions I get asked, and I'm sure you do too. It's like, hey, we've done this. I'm good in A, B, and C, but I need work in X, Y, and Z. What can I do? And for the brain gauge, I usually say there's a bunch of apps now on the tablets or on the computers. They can practice crosswords, are always good. With yours, it sounds like the breathing is good.
More breathing and trying to relax your brain, and also being more cognizant of, movement, exercising, and different kinds of movement and exercising to try to raise up that heart rate variability again.
And the oils and colors, as you mentioned.
Well, it has oils, colors, what kinds of food you should eat, what you shouldn't eat based on your test and how you responded, your chakras, which organs you need to work on. It will show you every organ, what's deficient or what's out of balance.
Wow, that's really neat.
And the teeth, and then it goes to the teeth too, and what organ or what's affected, different parts of your teeth. So it's very comprehensive.
That's neat. And you said the whole because obviously once you run something, you're going to want to go through it. About 45 minutes.
Yeah, I would say 45 minutes. And a lot of people have a lot more questions than other patients, and I don't want them to walk out wondering, but they get a huge report. It's the report is probably 20 pages, and I go through the screen, and it's a learning. It's educational for the patient, because there's no way that I have time to go through and explain, about the thyroid, about the, T3, T4, but I have everything, what their score is, and everything on a page, like a paragraph on each. So if they want to know, what each thing is, they can go home and read it. And that's up to the patient, how much information that they want to actually learn and kind of process.
That's great, because some patients want you're very accommodating. And also, both of the reports do go to the primary provider, the medical doctor here.
It will be in the system.
It's in the system, accessible, so that they can work on it from their end too. Maybe they have some other ideas with it. Wow, so in 45 minutes, what a comprehensive test. Mine runs mine's about 25, and then it usually is about 10 to 15 of going
so it's
over.
About the same.
So under an hour, you're learning a lot of information.
Yeah, and you have a lot,
and you know what you need to work on, and what you don't need to work on.
Exactly.
That's great.
Yeah.
All right.
Okay, awesome.
Thank you. Thanks for watching, everybody.
Thank you.